So this is a project we've actually been working on for many years now, where we have been very interested in trying to figure out what are the mechanisms of resistance to proteasome inhibitors, and many other folks in the field have been doing so as well. But one thing that we really hit upon was that when we were doing our proteomic profiling, linking back to the past question, we found that many different chaperones, so basically protein folding chaperones within myeloma cells, were upregulated in response to proteasome inhibitors. And so one of our hypotheses was that maybe this is a resistance mechanism that we can target. So we're very fortunate to partner with another faculty at the University of California, San Francisco, where I am, Jason Gestwicki, who he had developed a whole new class of allosteric inhibitors of HSP70, which is one of the chaperones we found to be most upregulated. And so we started a whole series of experiments where we're really interested to find that cell lines resistant to proteasome inhibitors were more sensitive to these agents, these HSP70 inhibitors. And so this made us think, could this be a potential therapeutic strategy for myeloma patients? And so we undertook a whole series of experiments to figure out, A, could these be drug-like molecules? And we did find that in general they do have pharmacokinetic and pharmacodynamic liabilities. So we're not at the point of having a real therapeutic yet, which is too bad, but we're still working on that. But we were able to investigate the mechanism of why are proteasome inhibitor resistant cells more sensitive to these HSP70 inhibitors. And so there we use a number of sophisticated proteomic methodologies to try and dissect that, what are these drugs doing? We eventually found that it seems that when you treat with these allosteric HSP70 inhibitors, they actually travel to the mitochondria and cause degradation of mitochondrial ribosome subunits. And so this really seems to be the key vulnerability, and this really hits with what's been seen from other recent studies that have come out, that in myeloma cells resistant to proteasome inhibitors, the mitochondria is really the linchpin of being able to overcome the resistance. And so some of our collaborators have shown that in other mechanisms. We've shown that with this drug. And so we really think that specifically the mitochondrial HSP70, called HSPA9, could be a really promising drug target in myeloma, and particularly patients refractory to first-line therapy. So that's something that we're really going to continue hitting on in the future, trying to go after HSPA9.